Morning. I'm in disguise, and you probably don't know who I am, so let me give the big reveal. It's Andrew Chilton, the medical director. This is a great opportunity to say thank you for all the incredibly hard work you've done. I'm coming to you virtually, and most of the people I've seen over the pandemic, I've seen virtually, apart from when I've been on the wards working. But what I do know, there's been incredible work done around the hospital, and so it's fantastic to be able to celebrate it on this occasion. There's three really important events for me every year, and those are the Educational Excellence Awards, Dragon's Den, and of course the Staff Excellence Awards. I absolutely love it, and it's wonderful to see the brilliant work that is done through the hospital, and it really is a feel-good occasion. The effort, the engagement that I've seen, the support, the compassion has truly been quite outstanding in this process. So it's a big thank you from me, and you all deserve an award.
Hi, I'm Anil Pasuth. I'm the Acting Director of Finance. I took over in August from Nikki. First of all, I'd like to say I'm really disappointed that obviously the Staff Awards are virtual this year. I don't get the opportunity to meet you all. That will be great in the future, and I look forward to doing that. The last 6 months have been an incredibly challenging time for us all. I would like to thank firstly the whole organisation for the way we've come together and delivered the services for our patients and our community and worked so well together. I'd especially like to thank my finance team and my procurement team and my commissioning team. The procurement team have been fantastic regarding PPE and have supported this organisation really well. And I think everybody has been really flexible, adaptable in the way they operate and very much come together. And it really shows the ethos and the way that we think of ourselves as a family, caring for ourselves, our patients and our staff. So thank you very much.
Hi, I'm Jo Focus. I'm the Chief Operating Officer at Kettering General Hospital, and this year the Staff Excellence Awards are coming to you virtually, which is a pity because last year I really enjoyed being, the centre of attention with the microphone. As you all know, I love the microphone, I love the camera. I want today to thank some of the teams that I work with because they are unsung heroes in the organisation. In particular, I want to focus on the clinical site team who work 24/7, 365 days a year. They have been immense throughout this whole COVID pandemic. So I want to thank all of those teams who work, especially at night time, to keep the organisation safe. But as you all know, we've had a really tough year, and I just want to say thank you to everyone in the organisation. As we've gone through the pandemic and the year itself, I have seen nothing but commitment, enthusiasm and engagement from our teams. And you have made this organisation a fantastic place to work and somewhere that I love coming to every day with a huge smile on my face. Thank you to everyone, and thank you from me and the whole executive team and the Trust Board and the Council of Governors.
So never in my 37 years of nursing have I come across such a situation that's tried to pull us all apart at the seams. What I do recognise is that those seams are very tight at Kettering General. We pull together, we've worked together, we've cried together, we've laughed together. And it goes without saying that I thank each and every single person, every volunteer, all our community support. I would, however, like to draw special thanks and attention to the We Care Cafe team, from a very small acorn of an idea that I had in my office one day to the transition and transformation and the development of that team to support each and every individual in the organisation as and when they've needed it is testament to the efforts that we place on staff support in this organisation. I would also like to thank Occupational Health, the Infection Prevention team and the PPE cell. Without them, we would not have had the equipment, along with procurement and supplies, to keep us all safe during this very difficult time, and recognise that there were challenges at the beginning, but we pulled together and worked through. I'd also like to thank the practice development team, without whom we wouldn't have all the student nurses, our aspirant nurses, our international nurses out in practice, supported and working well and competently and confidently to support our staffing gaps. I'd also like to thank the exec team. I am a member of the exec team, but actually I think the way that we've worked together in supporting the chiefs and the divisions as a collective has really helped us in this situation. Another thanks I'd like to give is to our allied health professionals and healthcare scientists and pharmacists who often go about their work behind the scenes but I know through the Raising Professional Profiles Forum how much they've been involved with in this pandemic times. And a number of OTs, physios, for example, swapping to work within our intensive care unit, alongside outpatients, nurses, and nurses that work in a totally different environment, seeing themselves in quite high levels of clinical practice. So it remains for me to say thanks to each and every single individual. And again, I reiterate our community support, our volunteers, and all of you. And I hope that if we go back into, or no, actually I know that if we go back into a second wave, that we will pull together again and our seams will tighten, and that will give us the resilience that we need. Thank you very much.